Okay, that worked. I will call the meeting to order and ask the secretary to call the roll. Here. Such as it is. We are here today to consider Senate Bill 2323. Not surprisingly, there's a committee sub in the best of legislative tradition. This is a bill by Senator Fillingane. Generally speaking, this is similar to bills we've considered in previous sessions. It attempts to give community hospitals more flexibility about various steps they can make to try to cooperate with each other, make contracts with each other, and enter into long-term agreements. It's, at least in my opinion, that we should give hospitals all the authority they have. We've got community hospitals all over the state, small hospitals that are struggling, we've got large hospitals that are struggling. And if they're going to stay open, I think, frankly, there are different options for different hospitals. It makes sense for them. There is some discussion of agreements among hospitals for various shared services and on and on. There are endless types of arrangements hospitals can make with larger hospitals or hospital groups. And so this has been discussed for several years. And I know that Senator Fillingane has worked on this for several years. And I'll let him explain the bill, but the bill that's before us is one that has been reviewed by, among other things, a bunch of hospital lawyers who say they know more about hospital law than some of the rest of us. But Senator Fillingane will call up Senate Bill 2323. I assume you move title sufficient to pass committee sub, and I'll recognize you to speak on that motion.
Thank you so much, Mr. Chairman. And yes, a hospital attorney, I am not. So I look forward to working with you all to make this the best bill it can be. But as you all are aware, we're having some degree of problems with some of our smaller community hospitals across the state, in all parts of the state, but more acutely in the Delta area. You've heard the news coming out of Greenwood and other areas. And unfortunately, there's a lot of restrictions placed on these entities as to who they can partner with and what they can do. So this bill is an attempt to clarify and expand the powers and authority of community hospitals in order to give them that greater flexibility in operating in the current healthcare environment, allow for consolidation of healthcare facilities and services, and encourage collaboration, joint activities with other health systems throughout the state. I'll go through just a couple of the key provisions, which may hopefully answer some of your questions. And then, of course, we can get to that. But that's the spirit of what we're trying to accomplish. What this bill does is joint ownership and activities with other health systems throughout the state, regardless of the location. So, for instance, using the example up in the Delta, there are several small hospitals there. But if they were to go and try to consolidate together, say bring 3 or 4 of them together and collaborate and come all under one banner to obviously save administrative costs and you know, those sorts of purchasing services, there are some restrictions that might prohibit them from doing that. One such thing would be, of course, the service area in which they are operating under. So under the current statutes and Mississippi AG's opinions, community hospitals may operate only within their designated service areas based on the patient origin data. The legislative bill here would allow community hospitals to form, fund, and operate nonprofit corporations or similar healthcare organizations through co-ownership with other public hospitals for a variety of activities throughout the state, such as joint hospital acquisitions, group purchasing, clinically integrated networks, payor contracting, and requests for federal and state grants and funding. Secondly, it authorizes them to enter into binding long-term contracts. So part of the problem you have, of course, these are multi-million-dollar entities and organizations. The board members have specific terms of service. Some of them, I think, as few as maybe 2 years, some of them longer, maybe like 4 years. But as with your local board of supervisors, you'll probably have heard from your supervisors saying we can't obligate a board sitting in our same seat beyond our term of service, which of course with supervisors is 4 years. The same is true in many instances with these local community hospitals. So if they want to do something beyond, say, a 4-year term for a multi-million-dollar contract or agreement, they really can't do that because they would be obligating a board member beyond their term of service. So this bill has language to seek to clarify that so that they could do something for longer than a 2-year, 4-year term. It authorizes them to assume financial risk. It is not clear that community hospitals have statutory authority to enter into value-based risk-sharing payment models. Historically, the AG has maintained that community hospitals have only such authority as it is expressly granted by statute. This legislation would specifically grant authority for community hospitals to participate in accountable care organizations and assume financial risk. Authority to make capital contributions. We believe that community hospitals have the authority to provide financial assistance to affiliated nonprofit corporations, which can then use such funds to make a capital contribution to a joint venture. However, there is not a statute specifically on the books or an AG opinion which expressly authorizes this arrangement. So some of these hospital attorneys and boards have been very cautious and not wanting to do so. Some have been more aggressive and have rolled out and tried to do that in the best interest of their institution. But nevertheless, this bill would clarify that they in fact do have that authority. So it would sort of take some of the murkiness out of or the guesswork out of that. Obviously, authority to provide financing. The Mississippi Attorney General has opined that community hospitals may not make loans or provide financial or financing because it is not expressly allowed by statute. The legislation would provide this authority and thereby allow community hospitals to finance joint ventures or other arrangements as needed and appropriate. And then I think largely antitrust protection. We ran into this in the Pine Belt, and I think some other hospitals around the state have also ran into the situation. The legislative bill provides state action immunity from federal and state antitrust laws and recognition of the need for hospital consolidations and collaborative activities. And so if you're within so much geography of the other entity that you want to combine with or purchase, there are some federal laws that say maybe you can't do that. And so a lot of the attorneys that work in this space have asked for guidance and direction on how to go about doing these things. Of course, private entities can already come in from out of state and cherry pick and do what they want to do because they're not bound by the tight geography. But your local community owned hospitals in many instances are prohibited from doing that. And so this language on the antitrust statute portion would provide some guidance that the state is doing everything we can to make sure that's not prohibited. So that's largely the bill in a nutshell. Mr. Chairman, I'll be happy to attempt to answer any questions.
Questions? Senator Parker.
So thank you for your work on this. I think this is definitely something we need to be looking into. One thing that I want to be sure of here is that, in this type of collaboration, as you're describing it here in this kind of coming together, in the further sections of the bill, when I look at section 4 and section 5, there's reference to an academic medical center and healthcare collaborative organization definition in there. Up in our area, we have Baptist and we have Methodist, our major hospitals. We're not too far away from the Delta. I want to be sure that we're not doing anything in this that would prohibit those entities from being able to collaborate with the community hospitals as well. So in the language in here, is there anything that would give preferential or special favor to one hospital over another?
No, I think just the opposite. If your hospitals up in DeSoto County would like to reach out and collaborate with the Greenwood, LaFleur, or one of the other hospitals that may need assistance, and I'm not trying to pick out anybody, we're all trying to improve healthcare across Mississippi and all corners. So I'm just using some examples that I've read about and heard about in the press, obviously, but right now, those local hospitals in the Delta that might wish to collaborate with your hospital up in DeSoto County, if it goes beyond a 4-year term, that they would obligate themselves beyond a 4-year period, which almost certainly it would. They feel handcuffed to be able to do those deals with anybody. So I think just the opposite, it would help unshackle them to be able to do business with any entity. They can already do business with privately owned entities. It's the community hospitals and with UMMC, by the way. They already have this protection and this ability. And that's why you heard earlier in the year and last year, UMMC, which would have been a great thing. We were all hopeful it would work out. We're in discussions with the Greenwood Hospital because they already have the authority to do this. We did that a couple of years, I think about 6 years ago, maybe, in the statutes to allow UMMC this authority to do so. They chose for whatever reason, financials or otherwise, that it wasn't in their best interest to move forward at this time. But maybe there's a hospital in DeSoto County that would wish to enter into that kind of agreement or collaboration, or down on the Gulf Coast, for instance. So we just want to have the community hospitals on the same footing with the private hospitals and with UMMC to be able to collaborate with any hospital in the state that may need to partner or have a joint agreement going.
So can you help me with line 621 through 623, where we're defining a healthcare collaborative to mean any consolidation or collaboration involving the academic medical center and any other public or nonprofit healthcare facilities and providers. And then we go on in, beyond that, because I guess, again, this is my, first read through this. As far as the committee sub, because we don't have a lot of bills assigned yet, and because I like to read bills, I've been reading some public health bills, so I did see the original bill, but I just want to be sure that we're making this available, in the way you're describing it to
Well, I think
everyone.
if you read that on 621, 22, and 23, healthcare collaborative means any consolidation or collaboration involving the academic medical center, which would be UMMC, and any other public or nonprofit health care facility and provider. I think that seeks to be as inclusive as it can be. And if you have some language to make it more so.
But wouldn't the word "and" there, though, require the collaboration to include the academic medical center? Or am I reading that wrong? When you qualify it as involving the academic medical center and any other, does the word "and" not imply that the collaboration would have to exist between the academic medical center and the other ones that are listed after that?
Let me check with our council here. All right, so section 3, the one you're reading from, is the section put in for University Medical Center specifically. The other sections of the bill are the ones that address this for the community hospitals. So this is not, the definition you're looking at is for the academic hospital, which is UMMC. So make sure that they're included in this overall legislation because they want the antitrust language. They have the power to collaborate. They don't have the antitrust language that this bill inculcates into the law.
And I do like your language. Before that, I just want to make sure in what we're
Yes,
doing
I'm with
here,
you.
because
If
it's
we see-
underlined, it sticks out when it's underlined in the bills here.
Yes.
I want to be sure that we're not
No.
creating a,
I think the reason there's that extra section is because, as we were discussing a little bit ago, UMMC already has a lot of these powers that were already in the law from a previous sitting down of the legislature about 6 years ago. The community hospitals don't have that power, but they all need the antitrust language that this bill provides. So this is a way of bringing in UMMC into the bill, allowing them to have the antitrust protections, but also then you're allowing the community hospitals and the other sections of the bill to have the powers that UMMC already enjoys to collaborate.
So section 4 and section 5 are new language then.
Yes.
You know, so everything after what we described there is new language as underlined and
I don't mean to butt in, and I think Senator Fillingane probably more up to speed than I on this, but this is what I think. I think 37-115-50, which is being amended, is more or less the powers and duties of the University of Mississippi Medical Center, as it were. And so this gives the University of Mississippi Medical Center the power to enter into these arrangements. If I'm Baptist Hospital, the Baptist Hospital System, or whatever they call themselves, or I'm the Methodist Hospital System, or whatever, my powers and duties don't have anything to do with what the state says the University of Mississippi Medical Center can do. I don't need, I mean, I've got that power because I exist. And so this is just to make sure, as I understand it, that the University of Mississippi can do the things which Methodist and Baptist systems already can do. I think that's right.
and if that's the case, I would be, you know, in favor. But again, you know,
As we
I'm-
go along, if you discover and point this out that this is handcuffing some hospitals in your area, that's certainly not the intent of this legislation. It's to allow more collaboration, not less.
Exactly.
Yeah.
And again, I appreciate your work on this.
Thank
and,
you.
You know, I appreciate your indulgence on the question.
For sure.
Senator Blackwell.
Thank you, Mr. Chairman. Senator Fillingane, I noticed that in this, that the bill refers to public and not-for-profit hospitals.
Yes, sir.
Why were the proprietary hospitals excluded?
Well, I think in an earlier version, we had some different language. I think as we were reviewing this, there were some concerns that you didn't want to relick the calf. And I think some of the private hospitals, like for instance, Ochsner's, they can already come in and, I mean, they're not bound by what Mississippi has put in place for our community hospitals. So why would you need to state?
Well, Ochsner's a not-for-profit,
Right, so they're gonna be okay.
right?
You're asking about the for-profit ones,
That's correct.
and I think they already have the ability to do these things. There's nothing saying that they can't do this stuff. So I think the idea was why confuse the issue by restating what they can already do. That's my understanding.
All right, thank you.
Mhm.
Senator Blackman.
Thank you, Mr. Chairman. Now, are you saying that where it says to provide that the academic medical center and its healthcare collaboratives acting individually or jointly shall be immunized from liability under the federal and state antitrust or competition laws, that Baptist, St. Dominic, Merit, that they are already exempted from the antitrust law?
We're wanting all of the hospitals to be exempt in Mississippi under the state preemption for antitrust. Now, in all fairness and transparency, the federal law obviously supersedes what the state law says. So by passing this legislation, even though it's our intent to make it very clear that if, Forest General wants to go down the road and purchase, Wesley, or do a collaboration with Wesley, or enter into some sort of agreement with them, because of their geographic location, we're saying that we believe it's in the state's interest to promote access to healthcare to as many Mississippians as possible. We don't view that as a violation and based on the state's interest in antitrust. Now, can I sit here and tell you that the FTC won't still come down and file a lawsuit and contest that? Of course, I can't tell you that because we can't control what the federal government does. But to the extent other states like Tennessee have tried this legislation, and they have it on their books, they have not had any problems with the FTC interventions.
Okay, so a Baptist or St. Dominic can go to Claiborne County, to Jefferson County, and have a collaboration with those institutions.
That's being hoped.
For clarification purposes, may I offer an amendment to provide that we include that the state level immunity would apply to the private hospitals and private not-for-profits.
Do you want to take amendments now, or do you want to?
But that's up to the chair. I'm happy to do what you'd like.
Okay, can you state the amendment and make sure the,
Okay, I don't know what line it's on because I'm reading from the short title. That we would provide that we would expand the bill to include state level immunity to private hospitals and private not-for-profits for
okay,
the
so
antitrust.
you wish to grant antitrust immunity to private for-profit hospitals and private nonprofit
Yes, sir.
hospitals. Senator Hobson.
Thank you, Mr. Chairman. Question on the amendment. Is the proposal to provide immunity for just antitrust purposes or for other immunity? That's the first question I would have.
I don't think that there's any other immunity in here, is it?
I
That's
just want to
the-
make,
yes,
I want to make
that's
sure
the-
that's the
yes.
amendment.
That's it.
Okay. Thank you. That's answers my question.
Do you know what line on the bill we'd be dealing with? Where? Okay, can you? Okay. Well, if we make those 6 different amendments, the net effect of all those amendments is to allow collaboration and antitrust agreement with for-profit hospitals. Okay. Is there further debate on the amendment? Are you ready to vote? All in favor say aye. Aye. All opposed, no. It appears the ayes have it. Senator Fillingham.
Thank you, Mr. Chairman. Happy to try to answer any other questions.
Senator Hobson.
Thank you, Mr. Chairman. Thank you, Senator Fillingham. And I want to make sure it's clear that community hospitals, there's no preclusion to them collaborating together. If you had 2 community hospitals, I noticed the language in here talked about the community hospital ability to acquire other healthcare facilities and operations, but there's nothing that would preclude it from being also another community hospital. Is that correct?
Not in, currently you mean, or in the bill?
In the proposed amendments?
Oh, no. We're actually trying to enable that because currently there are some restrictions, both the tenure on the board restrictions as well as the geographic restrictions of service areas.
Okay.
We're trying to remove those for community hospitals.
Thank you. I heard you explain some of the others and the nonprofits and the privates. I just didn't hear if it was community to community.
Yes, sir.
Okay, thank you. Thank you, Mr. Chairman.
Senator Blackwell.
Thank you, Mr. Chairman. Senator Fillingham, since we just passed this amendment
Yes, sir.
and it included proprietary hospitals, can you verify prior to you bringing the bill up on the floor that the private hospitals can collaborate with community hospitals?
Sure. I mean, we can research that and get an answer to that question for you.
Yeah,
Absolutely.
just so that we're not excluding anybody.
Sure. We don't, certainly not my intent to exclude people, but to include folks.
Anyone else? Yes, but I don't know who's in charge of what's going on, but I am not recognizing anything happening on the internet. This is a committee meeting. We're operating under the rules of the Senate. We're here in this committee meeting. I know of no authority for participating in meetings of the United States, the Mississippi State Senate by Zoom or whatever this is. So I'm recognizing people in the committee room. So the motion is title sufficient, do pass, committee sub. Are y'all ready to vote? That's committee sub, okay, as amended. All in favor, say aye. Opposed, no. The ayes appear to have it. The ayes have it. Is there a motion to rise and report? All in favor, say aye. Opposed, no. Thank you.